Welcome back to Today Lifestyle, everyone. I'm over here with Optim Neurosurgery, and we're talking all about some of the initiatives they have over there at their clinic. Let me introduce you once again to Dr. Stevenson and, of course, nurse practitioner Lauren. Welcome back to the show.
Thank you.
Okay, now I want to ask you at home, because I know this sounds quite silly. Sometimes I forget what everyone does. What is a neurosurgeon? Not just for the audience at home, but refresh my memory.
Okay, so a neurosurgeon is a physician who takes care of problems related to the brain, spinal cord, and nerves in the body. Primarily, our practice is primarily spinal, and that includes surgery, but I would say most patients that we see, we never take to the operating room.
Oh, really?
Really.
So you would prefer to cure with other remedies before operations?
Absolutely. I mean, surgery is, one thing that we're trained to do, okay? And if that's what we need to do, that's what we do. But the majority of our patients, through physical therapy or lifestyle modification or other things, we can solve your problem.
Alrighty, I want to ask you a little bit about the Women's Spine Initiative.
Sure.
Tell us a little bit about that.
So Dr. Stevenson and I went and talked to several OBGYNs in town. There are a lot of women that use OBGYNs as their primary care physicians and things like that. Women can get back pain during pregnancy. So we went and talked with them, things that we can do to help women with back pain during pregnancy or compression fractures or things like that. So we really focus on treating women's spine as well.
Well, again, probably a silly question, everyone, but is there a difference between a male spine and a female spine?
Absolutely. There are many problems that are unique to females. Pregnancy is one of them. When you're 9 months pregnant, your center of gravity is thrown off. Many women develop back pain. The treatment for that typically is deliver the baby, but there are things we can do to help. There are things we can
get it out of there.
Exactly, but there are things we can do. We work with OBGYNs on that. Osteoporosis is very much more common in elderly females.
Really?
Compression fractures, things like that. So treating that both with procedures as well as medications. The sacroiliac joint that we talked about previously, the female sacroiliac joint is much different than a male's, and for every one male that we see with a sacroiliac joint problem, we see 9 females. So we really recognize that women have some unique neurosurgical problems, and we want to be the practice that can help.
Well, tell us a little bit about how pregnancy does affect a woman's spine.
So like you said, the center of gravity, you've got all this extra weight that you're carrying around front and center, so it causes your spine to shift and your center of gravity is off. So that's why you see women who are pregnant that they have the pregnancy waddle. So the center of gravity is off, and that can put extra stress on the spine and cause back pain.
Is there any, you were going to say something?
There's also hormones that are released during pregnancy, specifically relaxin. That relaxes the pelvis, but that can make the ligaments a little bit more loose and can end up being a problem after pregnancy.
Okay, so now you were saying that about being pregnant, of course. I'm going to ask a question, one of my own thoughts. Is there any way you can have some type of brace that's holding the tummy for a little bit of support that's going over the shoulders? Does that make sense?
It does, and I've not thought about that, but that actually, it's an intriguing thought. And we actually work with a brace person, so when we leave here, we might stop by his place and talk to him.
Can I trademark that?
Absolutely, we'll get together, we'll have a meeting. Absolutely.
I literally just thought about it, and because I'm thinking...
No, that actually... It's kind of an interesting thought, actually, and I do want to talk to him.
Yeah, see? I like that.
Perfect.
Right. Tell me a little bit about the compression factors, and I've got to go, so make it quick.
Sure. Osteoporosis is a fairly common thing in elderly women. People can get fractures. They're not dangerous, but they can be treated typically with time, but also we can inject a cement into the vertebra to instantly heal it. Occasionally we need to do surgery, but again, it's a unique female thing.
I love you guys coming in. You always have great information, and I'm keeping you to that trademark.
Perfect.
If you want to find out more information about Optim Neurosurgery, there it all is up on the screen. Everyone, give them a call. You can tell they know what they're doing. Back after this short break.